My name is Dr. Fidele. I'm a neurologist at Aga Khan Hospital, Kisumu. I deal with different conditions which majorly affect the brain, the spinal cord, the nerves arising from the spinal cord, the muscles, even that connection between nerves and muscles. So these conditions are actually diverse, and we usually have forced us to establish certain services related to the condition we receive. And if you look, for instance, in our outpatient clinic, we receive majorly the headaches. The headache, and I would say maybe followed by epilepsy. We receive also some movement disorder like Parkinson's disease. We receive neuropathies. So it's a clinic which usually operates daily, Monday to Friday, and morning to 8 to 5. Majorly, this outpatient clinic is beyond to review the patients. We do also some neurological testing, and these are grouped in our lab, which is a neurophysiology lab, having the electroencephalogram, which is EEG. This records usually the brain activity and can help us to know the physiology of the brain, specifically when you are investigating some causes of epilepsy or trying to understand what type of epilepsy. The other neurophysiology test, which is commonly known, is the nerve conduction studies, EMG as a whole, electromyography, which also can help us to assess the peripheral nerves. Beyond the outpatient clinic, we have also inpatient services, and this covers neurology emergencies, which are commonly stroke. To understand stroke a little bit is that we have two types of stroke. The one which is hemorrhagic, where the blood vessel has busted, and you have that one which is ischemic, where the blood in the vessel is no longer passing, it's obstructed. So stroke is one of our major emergency. We have seizures at our emergency services, and several other causes of loss of consciousness, which can affect individuals and lead them to immediately consult our services. Now we are a stroke-ready hospital, which can offer thrombolysis. Thrombolysis is all about that process I explained earlier of reversing a stroke which is happening. So another specialized neurology services on board now is epilepsy monitoring. We are soon opening a sleep lab, and this actually consists into trying to understand the type and the cause of seizures, recurrent seizures defining epilepsy. So this is done usually with a specialized machine, EEG, which is connected and simultaneously recording the video, and we can know what is happening outside and inside with the brain, looking on the physiology, what those waves the brain is generating. This will help us to understand this is the type of seizure, if it is a seizure, of course, and it is originating most likely from this region of the brain. And then from there, we can advise what are the possible treatment. So one of the trigger which can make a patient or one of our clients to come and consult for the headache, first of all, they might be referred. But when to see a neurologist because of headache? Headache can be a symptoms of millions of conditions. It's not necessarily a must to see a neurologist. But you see, for instance, we classify them as primary or secondary headache. Those primary headaches are the headaches which don't have any other explanation in the body. So primary headaches, the first, the most common would be migraines. So migraine is a headache which is common, sometimes can be looked at as easy to treat, especially when they are not very chronic, because some painkillers can stop it. But now this might require neurological input, especially when these frequencies are quite very high. Like you have more than 1, 2, 3 headaches per week. So a neurologist will be able to advise what is the best treatment related to that condition without necessarily depending on painkillers. So this is one of the examples, but epilepsy, sometimes you need to find how are the seizures are controlled. Usually your doctor or your healthcare provider will be able to know. Now at this stage, maybe we need those specialized testing or input from a neurologist. So thank you.